Hi, this is your Houston chiropractor, Dr. Gregory Johnson. We have Mauricio here with us this morning, and Mauricio flew all the way down here from Massachusetts to have me examine him and analyze his MRIs and his lower back pain, the shooting pain all the way down in his right leg, all the way down into the ankle. He's smart. He brought his MRIs with him, and I just looked at those. Now, it's interesting that the medical profession doesn't recognize vertebral subluxation. It says here in the findings there is no subluxation. Well, he has subluxations in his SI joints and L1 through L5. His entire lumbar spine has flattened out from normal. He has a very large herniated disc at L4, L5 that's causing severe spinal canal stenosis, and it's causing lumbosacral radiculopathy, which is the pinching of the lumbosacral plexus nerves, the sciatic nerve, sciatica, all the way down into his right leg and ankle. And that's been going on for how long?
About since July of last year.
Since July of last year, that's right. And you've been to another chiropractor and went a couple times, and they didn't really do much for you, you said?
No.
And the reason you flew all the way down here to Houston?
To get the, ring dinger mainly, and just to meet you and get my, hopefully this resolved.
Yeah. You're going to be here all week, right?
Yeah.
So we'll follow your progress up this week.
Yeah.
All right, so I've already done my orthopedic neurological evaluation and examination history on him, and was that thorough?
Yeah.
Good. Okay, let's have you close your eyes and bend your head forward and backwards for me, Mauricio. I've already done this too, but I just wanted to show you. He's got forward head posture in the Z-axis. His ear's dropping way out here from his clavicle, which is adding additional weight-bearing compressive stress all the way down. Just looking at him, he can tell he is a side sleeper because his head's cocked over to the side. His pelvis has shifted left of center down here on the x-axis. He's got a little curvature in his spine in his mid-thoracic here. We call that a scoliosis. So we're going to get him his first adjustment today. And his right sacrum is deviated too, and that's affecting his right sacroiliac joint. So that's contributing to the sciatica. Let's go ahead and lay on your tummy here for me, Mauricio. I am going to show you one important test that we did. This is important too. His right leg's shorter by 1/2 inch in this position, and when I bring his legs up, it gets even. That tightens up in your lower back, doesn't it, Mauricio?
Yeah.
Okay, so I'm going to have you lock your right leg straight, lift your entire right leg off the table. Now see, you can't hardly do that, and that's painful too, isn't it, Mauricio?
Yeah.
Do the same thing on the left. See, that's better on the left side. Doesn't hurt as bad either, does it?
No.
So he's got a right sacral posterior deviation here, which is pinching on the lumbosacral nerves coming out between L5 and S1 as well. And then, so I'm adjusting his right SI joint first. And then his sacrum on the right side. And then the left SI joint. This is going to feel a little deep and probably a little bit sore at first. That's what I'm doing. Good. I'm going to go up a little higher because I'm going to adjust you on that knee chest table too. There you go. Oh yeah. Good. Felt all those, didn't you?
Yeah.
Okay, you're going to feel your head popping up a little on this next one. Good. Okay, let's train you on your back here now. There you go. Boy, oh boy. Now, let's have you get off sideways. And we're going to come over here on this table. And yes, I did the Palmer Diversified Rotary Brake on the BioPhysics table first. He didn't really complain of any neck pain or anything, but it's out of place anyway, so I'm going to adjust everything that's subluxated in his spine. Just let your spine kind of sink down in here with gravity. On this one, Mauricio. There it is, right there. Okay, now let's come over on this table. Alright, we're going to lay you on your back, butt right here. Head up that way, please, sir. Now, in our history, I always ask if the patient's had any bladder or bowel dysfunction, meaning losing control of your bladder valves, because that's a serious neurological issue which needs to be dealt with surgically. Now, look at there already. Now, you didn't have those a while ago, did you?
No, not at all.
There you go. I don't have to ask twice if you felt that one all the way down.
Oh, God.
A little different version, isn't it? Look at there. You didn't have any of that
No.
10 minutes ago when I did your exam. Okay. You know, I'm going to adjust your leg on this table because I didn't do it on the BioPhysics table. So I'm going to decompress you from both ends. You should have felt that one all the way down. Probably a little sore at first. There you go. You should have felt that all the way up to your low back, did you?
Yep.
Okay, see here, let me have this. There you go, good. Okay. Now let's sit you up and face out the window this way. There we go. That's good. Yes, sir. Get your elbows, your wrists. See, I can tell I got good adjustment because I got palms of your hands sweating. That's the autonomic nervous system functioning.
That was,
Intense adjustment.
yeah,
wasn't
yeah.
it? A little different than what you've
Very
been
different,
used
yeah.
to.
Nothing like the videos.
Oh yeah, it says everything like the videos, just different in person.
Yeah.
Okay, let's stand right here and face the mirror for me. Alright, so I'm going to have you close your eyes and flex your head forward and backwards for me again, Mauricio. That already should feel a little smoother than the first one.
Yep.
Take a look in the mirror right now compared to the first one.
Yep.
Your chin's up higher. Pull these shoulders up and back. This is going to be your homework right here. Flip these back like this. See, we're going to bring the head straight back first and then look at the wall behind you. Full extension. Now, you'll probably feel that all the way down your lower back. Do you? There. Extension is your friend, flexion is your enemy. In fact, that's how you got in trouble in the first place, isn't it? You just bent over to pick something up and got stuck there?
Yep.
Had to call an ambulance, take you to the hospital?
Yep.
Okay, Marisa, let's have you flex your head forward and backwards again. Back to neutral. That should have felt even smoother.
A lot better now.
Yep. Take a look in the mirror. You're right down the middle everywhere.
Yep.
Walk around and tell me how that right leg feels right now compared to how when you walked in the door.
Feels lighter.
Yeah,
My-
your whole body feel lighter?
Easier to, it's like easier to move. Yeah.
Are you having as much right leg pain as when you walked in the door?
No, it feels like
Feel like you're getting blood back down in there, nerves?
I feel something, but it's not like nowhere near like this
The
morning.
level of pain there wasn't.
Yeah.
Good. So everybody wants to know how your very first experience on the spinal decompression is. What would you
Yeah.
tell them? What's
It's
your personal
Yeah.
experience?
very intense. It was I felt a very strong relief. It was just very intense. Like
Gets everything in one split second,
Yeah,
doesn't it?
and it's
That's
very
why we
quick
call it
too,
ring
so,
dinger.
yeah.
Yep.
yeah. So it's
Very
very
good.
good. Yeah.
So we'll be following up Mauricio's case with y'all this week along the way. He's going to be in twice a day for 3 days in a row. We're not going to be here on Thursday this week. So, Mauricio, thank you for
Thank
sharing
you.
your experience with
Yeah,
everyone.
Thank you.
This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas. We'll see y'all soon.